Community Health Worker Training, Cardiovascular Health and Diabetes, Mini-Module 10B, Mental Health and Wellness. Learning outcomes for this mini-module. Upon completion of the module, participants will be able to explain depression, describe the signs of depression. What is depression? Depression is a disorder that affects a person's ability to eat, sleep, feel pleasure, and function in everyday life. Those affected feel an overwhelming sadness most of the time. Depression affects the mind and the body. Everyone occasionally feels blue or sad, but these feelings are usually short-lived and pass within a few hours or a few days. When you have depression, it affects the way you eat and sleep, the way you feel about yourself, and your ability to function in everyday life for a much longer time. People that are depressed have less interest in activities that used to be enjoyable. Depression can cause pain for both the person experiencing it and those that care about them. Depression is a common but serious illness. Depression is not a sign of personal weakness, and it's not something that can be wished away. Without treatment, depression can last for weeks, months, or even years. But most people, even those with the most severe depression, can get better with treatment. Click on this link to watch a YouTube video that gives a great overview of depression, causes, treatment, symptoms, and so forth. Then come back to the PowerPoint.
Depression is the leading cause of disability in the world. In the United States, close to 10% of adults struggle with depression. But because it's a mental illness, it can be a lot harder to understand than, say, high cholesterol. One major source of confusion is the difference between having depression and just feeling depressed. Almost everyone feels down from time to time. Getting a bad grade, losing a job, having an argument, even a rainy day can bring on feelings of sadness. Sometimes there's no trigger at all. It just pops up out of the blue. Then circumstances change, and those sad feelings disappear. Clinical depression is different. It's a medical disorder, and it won't go away just because you want it to. It lingers for at least 2 consecutive weeks and significantly interferes with one's ability to work, play, or love. Depression can have a lot of different symptoms: a low mood, loss of interest in things you'd normally enjoy, changes in appetite, feeling worthless or excessively guilty, sleeping either too much or too little, poor concentration, restlessness or slowness, loss of energy, or recurrent thoughts of suicide. If you have at least 5 of those symptoms, according to psychiatric guidelines, you qualify for a diagnosis of depression. And it's not just behavioral symptoms. Depression has physical manifestations inside the brain. First of all, there are changes that could be seen with the naked eye and X-ray vision. These include smaller frontal lobes and hippocampal volumes. On a more micro scale, depression is associated with a few things: the abnormal transmission or depletion of certain neurotransmitters, especially serotonin, norepinephrine, and dopamine, blunted circadian rhythms, or specific changes in the REM and slow wave parts of your sleep cycle, and hormone abnormalities, such as high cortisol and deregulation of thyroid hormones. But neuroscientists still don't have a complete picture of what causes depression. It seems to have to do with a complex interaction between genes and environment, but we don't have a diagnostic tool that can accurately predict where or when it will show up. And because depression's symptoms are intangible, it's hard to know who might look fine but is actually struggling. According to the National Institute of Mental Health, it takes the average person suffering with a mental illness over 10 years to ask for help. But there are very effective treatments. Medications and therapy complement each other to boost brain chemicals. In extreme cases, electroconvulsive therapy, which is like a controlled seizure in the patient's brain, is also very helpful. Other promising treatments, like transcranial magnetic stimulation, are being investigated too. So if you know someone struggling with depression, encourage them, gently, to seek out some of these options. You might even offer to help with specific tasks, like looking up therapists in the area or making a list of questions to ask a doctor. To someone with depression, these first steps can seem insurmountable. If they feel guilty or ashamed, point out that depression is a medical condition, just like asthma or diabetes. It's not a weakness or a personality trait, and they shouldn't expect themselves to just get over it, any more than they could will themselves to get over a broken arm. If you haven't experienced depression yourself, avoid comparing it to times you've felt down. Comparing what they're experiencing to normal temporary feelings of sadness can make them feel guilty for struggling. Even just talking about depression openly can help. For example, research shows that asking someone about suicidal thoughts actually reduces their suicide risk. Open conversations about mental illness help erode stigma and make it easier for people to ask for help. And the more patients seek treatment, the more scientists will learn about depression, and the better the treatments will get.
What are the causes of depression? We believe that there is a genetic component to it because depression sometimes runs in families. It seems also to be related to an imbalance in the brain chemistry. So the hormones or the neurotransmitters in the brain that help people to feel emotion, to feel excitement, interest, happy, sad. People with depression have an imbalance of those chemicals in their brain. One of the things that can affect those chemicals is the use of drugs. So sometimes people will use drugs or alcohol when they feel depressed to try to feel better. Other times people who are using drugs can affect their brain chemistry sort of as a side effect, and the outcome can be that they can become depressed. Certainly stress can lead to depression if it's not handled well. In terms of physical health issues, medical problems such as stroke, heart attack, or cancer can cause a person to become depressed. And they may be depressed in part because they can no longer do the things that they used to be able to do. In some cases, they can no longer even take care of themselves. But in addition, depression itself can interfere with a person being able to take care of themselves. Depression is about twice as common in women as in men. Changes in the level of hormones in a woman's body may play a part in increasing their amount of depression. For example, women can develop depression after giving birth, which is called postpartum depression, when hormonal and physical changes and the new responsibility of caring for a newborn can be very hard, not to mention the exhaustion of caring for a newborn. Men are less likely than women to admit to being depressed, and doctors are less likely to suspect depression in men. Depression shows up differently in men and women. Women with depression are more likely to feel sad, worthless, hopeless, and helpless. Men are more likely to be very tired, irritable, angry, lose interest in once enjoyable activities, and have a hard time sleeping. Men may be more likely than women to turn to alcohol or drugs when they are depressed. They may also become abusive. Some men throw themselves into their work to avoid talking about their depression with family or friends, or behave recklessly. Depression is not a normal part of aging. Most seniors feel satisfied with their lives, even with having more illnesses or physical problems. But when older adults do have depression, they may be less likely to admit to feelings of sadness or grief. Sometimes it can be hard to tell the difference between grief from major depression. Grief that lasts for a very long time following a loss may need treatment. Older adults also may have more medical conditions such as diabetes, heart disease, or stroke, which can cause depression. Or they may be taking medicines with side effects that contribute to depression. So what are the signs of depression? Persistent sadness. So we all have, sometimes where we're feeling sad, but depression is more having that sadness that just doesn't go away over the period of weeks or months. Feelings of hopelessness or guilt, loss of interest in activities that the person once enjoyed, withdrawing from family or friends, thoughts of suicide or death, having a hard time concentrating. So sometimes when someone's depressed, it's really hard for them to learn. They may say that it feels like their thoughts are like swimming through molasses, just really hard to think or to concentrate. Feeling really tired all the time. Having trouble sleeping or sleeping too much. Noticing changes in appetite, and it could be a complete loss of appetite or eating too much. Restlessness or irritability, and in some cases, alcohol or drug abuse. And it's not that a person has to have all of these symptoms to have depression, but several of these symptoms do suggest that the person may be depressed. And even if they only have one symptom, if it's the persistent sadness or the thoughts of suicide or death, that's a person who needs to have an evaluation and should be referred to a doctor or a psychologist for an evaluation for depression. Let's hear from some people who've experienced depression. Click on this short video to listen to them describe what it feels like.
The best way I can think of now to describe it, that you're carrying 50 pounds of weight, but you can't ever put it down.
It hurt my body, the depression. I really couldn't function at a high level.
I don't wish depression on my worst enemy.
Depression is just so debilitating. It affects every single part of your life.
Every antidepressant you could think of, I had been on.
It was just really bad. I just felt like I couldn't fight my way out of a paper bag if I wanted to. I just couldn't do anything.
And I think people probably think you're exaggerating and like, how could it possibly be like that? But it is.
I was a different person 6 or 7 months ago.
I laughed more,
I've never had so much energy and been so happy.
and I didn't feel helpless. And that was so good. It was like, wow, a whole new life, yay, you know?
There's no downside.
This is what everyone should feel.
I'm hoping that people will see me and know there's an answer. There's a solution. What medication and therapy couldn't do for me alone, Deep TMS did.
So in addition to helping a person who's depressed get into formal treatment, how can you as a community health worker or how can you as a friend help someone who may be depressed? So talk to them and more importantly, listen to them. Tell them that you're concerned about them. Sometimes you need to say, I'm really concerned that you've seemed like you've been feeling sad for weeks now, and I'm worried that you might be depressed. Offer support and understanding. So don't say to them, oh yeah, we all get down sometimes, or, just try to look on the bright side, because that is going to feel very judgmental to them. And they may also be feeling guilty. Sometimes people say, like, I have no reason to be depressed. I don't know why I'm depressed. And so making comments like that is going to make them feel even worse. So be supportive, show them that you understand. Don't dismiss their feelings. Really do a lot of listening. Never ignore talk of suicide. So sometimes we're afraid to talk about suicide because we think it's going to push the person to actually do it, or it's going to plant ideas in their head. And lots of studies have been done, and that is not the case, actually. Sometimes when you bring up suicide, when you ask the person, are you having any thoughts of hurting yourself? They feel a lot of relief because they were too embarrassed to admit it. And once you kind of open that door and let them talk about it, you can help get them into treatment so they won't act on those feelings or those thoughts. Invite the person to go for a walk. Sometimes people who are depressed really don't have energy to do much of anything. So sometimes just taking a walk, just getting outdoors can help a bit. Really support them to go see their doctor. Okay, they really need help, and there is treatment, and it's effective treatment. And finally, help them to go, okay? So sometimes it can be overwhelming to a depressed person even to pick up the phone and call and make an appointment. And so you may need to just help them take that step. Now you can explain depression and describe the signs of depression. In the next mini module, 10C, you'll learn about depression treatment and the community health worker role.